Hey guys, Rach here. So what you're about to see is me on a table as I'm working with Colleen Godfrey as she's doing her somatic therapies. Now I'm not going to give you a play-by-play, but if you want to know more, you can go over to our podcast, Infusion Health, Part 2 with Colleen Godfrey and Somatic Health. And with that, onto our footage.
And I'm just going to take a look at your shoulders. It looks like this shoulder's a little low and this one's riding up a little high. Is it usually like that? Have you noticed that?
I had a really bad migraine this morning.
Okay.
So
Yeah. And then I just look at your head and I notice that your head is leaning just a tad bit. Chin's just slightly off center there. And then if I can have you put your hands down by your side.
Sure.
I'm going to put my hands
Yep.
along your rib cage, and I'm just going to be checking to see if there's any restriction in movement or how free-flowing your rib cage is sitting here. So, and we're just going to rock first side to side, see if there's more movement one way than another. And can you feel how I'm really able
Yep.
to move it
Mhm.
off to your left
Yeah.
and off to your right? It doesn't want to go.
Right.
So what I'm going to do is just take it in the direction it doesn't want to go,
Okay.
just lightly, and I'm just going to hold it there, and you'll just breathe. And that's exactly right. Just let your breath do whatever it wants to do. Because a lot of times with this, there'll be the whole respiratory diaphragm will be reset. And when the respiratory diaphragm resets, we feel really relaxed and yummy. There we go. And I'm going to rock it just the other direction. And push up. And I'm not pushing very hard. It's a pretty light touch, wouldn't you say?
Yeah.
Yeah.
Very light.
So light touch is really relaxing and therapeutic for the body. So I'm going to take it again this direction, still feeling somewhat restricted. And we're just going to... Feels like you're getting some nice deep breathing with that. I'm just going to check again. It's easier. Do you feel that?
Yeah, I feel the difference.
It's loosened up.
Yeah.
And so that, what happens for a lot of people with trauma is the respiratory diaphragm really gets hung up in some way, and we want to loosen it back up so you can feel the breath all the way down into the belly. And I can feel your breathing is deep now and fluid. So that's good. Okay, so I'm going to reach an arm across.
Okay.
And what I'm going to do is it's just gentle rocking.
Okay.
And we just rock gently. How does that feel?
Kind of like I don't want to.
You don't like it?
No, not that I don't like it. Just like I want to resist.
Okay, well just relax. And try not to resist, but it's good to know what's coming up for you. And we're just going to rock a little bit. Side to side. Rocking is really soothing. So I'm going to rock both sides and then go down to your feet. And we'll rock up and down, up and down. Okay, and we'll just come around to the other side. And as I come around, notice in your body if you feel any more relaxed. I know you said there was some resistance.
Yeah.
Just notice,
Mm-hmm.
has anything shifted? And so we're just tuning in
Yeah.
like that, checking
So
in.
my whole thing is that it's hard for me to trust, and I just
Yeah.
feel a little bit more trustworthy. Like I can trust you more.
A
So, yeah.
little bit more trust.
Yeah. Yeah.
Okay.
Like.
Yeah. Okay.
Yeah.
So now we're going to do it on this side as well. I'm just going to get my arm underneath there.
So yeah, I feel a lot more.
And we're going to... So you have a sense of being able to trust, and that's critical for healing.
Mm-hmm.
We want to get back to trusting. So just rock back and forth, and that's perfect. Let your head go just like that. And how is it feeling?
Yeah. Good.
Okay. Well, now I'm going to check your rib cage again.
Okay.
We're just going to see. Ooh, it's even more open. Do you feel how open that is?
Yeah.
Now? There's a big release there. So if you breathe in now, you should be able to feel like that breath go
Yeah.
deep. Do you feel that
Yeah.
deep belly breathing
Yeah.
now? That's what we're trying to get to, is that relaxed state. Now I'm going to have you come a little bit more this way because I want your feet to actually come off the table.
Okay.
And I'm going to, oh, not quite that far, back up a little bit. Yeah. I just want to be able to hold them.
Okay.
And your feet, so your legs are going to be stacked. Your joints are stacked.
Okay.
And now I'm just rocking you. And I'm trying to find your natural rhythm. And your head should bob up and down. So this is what we're just going to tune in. And we want to get it to where it's like the waves of the ocean, just a beautiful, relaxing rocking. And how is that feeling?
Yeah.
Are you able to receive it?
Mm-hmm.
Does it feel nurturing, or how does it
It
feel?
feels nurturing, but I still feel the resistance, you know.
Sure. Usually, I would build more rapport, and we wouldn't just go straight to the table.
Sure.
But I just want your nervous system to feel.
Right.
So we'll just be quiet. We'll just do a few more here. Okay. I'm going to let your feet go.
Okay.
And I'm going to have you push back so your head is close to the top of the table.
Okay.
And just notice how that feels. If your body feels more relaxed or receptive or...
Mm-hmm.
Okay. And I'm going to a little bench here. I'm just going to put some more pressure on your shoulders.
Okay.
And do a little rocking from side to side of the shoulder. How's that feeling?
Mm-hmm.
It's good?
Mhm.
Okay. So So notice that your right shoulder was a little bit low
Mm-hmm.
and the left was a little bit high. And so the body sometimes indicates different things about our lives.
Mm-hmm.
So sometimes people who have a low right shoulder, they might have had some issues with their mom.
Mm.
Sometimes they won't have had a mom, or they just had a challenging relationship with their mom at times. Other times it has to do with our feminine side, and sometimes the left side is indicative of things as well. Let's just see here. How's that feeling?
Good.
It feels like you're very relaxed, like I can feel that your body has relaxed.
Mm-hmm.
So I'll just do that. Okay. Now I'm just going to reach under your occiput and give a nice little stretch here. How does that feel?
Good.
Yeah,
Yeah.
most people really like this. We hold so much pressure. There's actually 44 muscles in the neck.
Oh.
There's about 18 muscles in the face, and we hold a lot of tension here in the neck. Is it okay if you take off your glasses?
Yeah.
Yeah, let's just do that. Is it okay if I touch your face?
Yeah.
Okay. So we can do a couple of different things, and one is the hyoid bone is a little bone that floats under the jaw and is usually in line with your molars.
Okay.
And then you can just rock this little tiny bone side to side. And that releases a lot of tension. And sometimes we have issues with communication of holding back.
Mm-hmm.
And that tension will settle in around the chin and the neck. And we can just rock this little hyoid bone back and forth. And we can find the jawbone around here. We'll just find your TMJ bone if we can find it. Does that feel right?
Mm-hmm.
Yeah. And then we just give a little light massage like this. These are all soothing, and relaxing. Nurturing. And it helps our whole body relax when we're nurtured. And the other thing we can do, I want you to notice, I'm going to do a very light touch.
Okay.
And I want you just to tune into your whole body and notice if these very light, I'm going to try to find where there's a little tension, and we're just exploring tension. This is very light touch. It's almost like if I just wanted to move the sheet on the table.
Okay.
And I want you to see if your body responds in any way to this, anywhere in your body. I'll just do it a few times here. So we have skin and muscle and nerve endings and ligaments and fascia. Fascia is a kind of coating that goes around and through the muscles and adds some structure to it. And we're just communicating with all those parts of ourselves when we do this very gentle touch. I want to know if you feel anything in your body as I'm doing this.
Sorry.
Okay. Just gonna do some touch. So this is a little cranial sacral therapy. You just use a light little touch. How does that feel?
Good.
Or we can do this with babies right after they're born, and it helps if they had any trauma coming through the birth canal. And this is just called Trigeminal Stimulation. It's a very light touch, the way that a mama might soothe a little baby. And we can do it down here. And how does your body respond to this light touch?
It's hard.
It's hard to receive
Yeah.
the touch. And is there a memory that comes with it?
Yeah.
Do you want to process it a little or not?
Sure.
It's okay. It's okay if it's hard. You let me know if you want to stop. It's up to you.
We can keep
You want to, okay, so what would happen now is we would process what you're feeling and put a name to it. Can you describe what's happening?
just having a memory.
And what is that memory?
I was the oldest in my family. And I always tried to do right by my mom and dad and protect my sister and brother. But I know not always felt accepted by my mom.
You didn't feel accepted by your mom.
Not always.
Not always. And that brings up a lot of sadness. So what would your adult self say to that girl who wanted acceptance from her mom?
That you're doing the right thing. You can keep doing the right thing, and all the bad things that you're doing right now, you'll be a positive light for people's future and be a strong person in the future.
Okay. I just want you to imagine loving that little girl. And you can close your eyes and just take her by the hand and give her the love that she needs. Do you see her? What does she look like? What is she wearing?
Blue jeans, and she's sitting in front of the TV.
She's watching TV. She's in her blue jeans. And you are there and you're giving her some love, and how did she receive that love?
She's happy.
She's really happy. So I want you to feel that happiness and let me know where you feel it in your body.
Here.
In your heart. So that girl, and how old is she?
About 9.
So she's 9 and she's receiving your love and she's happy in her blue jeans by the TV, and her heart feels full, and your heart feels full now too. And I want you to invite that 9-year-old adorable version of yourself into the present. And know that she can be with you. She can be with us here today. And what message does she have?
Accepted.
She feels accepted now. She feels accepted. So initially there was a lack of acceptance, and now she's feeling accepted. So take that in. So part of the process is just to go slow and savor and take this in. She feels accepted. And what's coming up for you now?
Pressure.
Where's the pressure?
Here.
Right into your chest. There's pressure in your chest. Okay. Can I put my hands just here a little bit? There you go. Let it out. And what's happening with the pressure now?
It's easing.
The pressure's easing. Okay, good. And what else are you getting right now?
I can breathe.
You can breathe. Good. Very good. That's good. So a lot of times we get that deep release, and we know that we've released something that was fragmented because we can breathe. And sometimes we might feel some constriction and then a release. So I'm just going to work here at the back of the head, the occiput. What do you give right now?
A wave.
A wave of energy?
And just a wave, like
A nice wave. I want you to stay with that wave if you can connect with the energy. And what is it like? Is it tingling or warm or?
it's warm.
It's warm. And I just want you to put your awareness on that warm tingling and just follow it wherever it wants to go, and just keep following it. And we're following it. And where's the tingling now?
It's kind of like a blanket.
It's like a blanket. Does it feel good, like a blanket in a good way?
Yeah.
So it's kind of spread out now. It's not just a current going down. It's kind of spreading out, and it's comforting to you.
Yeah.
And we want to take in those good feelings of that comfort. And that's your body regulating itself, knowing how to come back into these feelings of comfort, and to have these beautiful sensations in your body, blanketing you, holding you. And is there any place in your body where you're holding on to tension right now?
Kind of like in here.
Okay, so just tune in. And what does that sensation feel like?
Kind of like, I don't know, it's kind of hard to describe.
Okay. But it feels tight or tense or
kind of tight.
kind of tight? And then I want you to tune back into a part of your body that doesn't feel tight and describe that.
Kind of like my feet aren't tight.
Yeah, and you can feel your feet. Can you feel the tops of the feet?
Yeah.
And the ankles. And all the way up the legs. And are you able to connect in with that feeling of that kind of tingling blanket?
Yeah.
Yeah. Now let's check back into that tightness. Is there anything else there with that tightness?
It's easy now.
It's easing up. Good, good, good. Just do some light release. Cranials. And what else are you getting? Anything else? That's a nice relaxing breath. Are you feeling more relaxed? Yeah. It feels like whatever that was, like it completed itself. Does it feel that way to you?
Yeah.
Yeah. Have you ever worked in this way before?
No.
Okay. So I didn't do the deep work. The really deep work, like we would be locked in for quite a long time.
Yeah.
But that one, I can just show you while you're here. There's